opens your mind to things, and it helps you to see things in a much more positive way.
Yeah, and I think also the simplicity of how Dr. Pilant presented what the protocol was about, talking about your immune system and having soldiers and policemen in your immune system, and basically the soldiers were there to identify and kill off
to deal with the problem.
The problem, and the police were there to keep the status quo, to keep
you safe.
Keep you safe. So when you look at that, and then you divulge into that in terms of how the medication works, the immunology works, it's very simple, and it's very easy to believe.
Yes.
And I think as you've mentioned, it's keeping the faith and keeping the belief, keeping positive. And there are times when the results don't always show in the right direction, but that's the point of the results, to then adapt the medication. And the best result of all has been for you to have a completely clear MRI scan that says there is no evidence of prostate cancer.
Yeah, the recent MRI scan has shown no evidence at all. Totally reversed the picture that was being shown by the first MRI scan I had. And I have to say, I've made some very critical comments about the health service approach in the UK. Through all of this, my GP has been 100% supportive of my alternative approach to dealing with the problem, without taking sides in inverted commas as to what is the best approach and what isn't. She understood that it was important for me to go down this different avenue, and she is delighted by the outcome. It's not easy.
No.
It's not easy, but it's well worth it.
Yeah, absolutely well worth it. I mean, and also you've not only got the good results from the cancer being clear, but your skin is clearer, your hair's growing back, you feel you've lost some weight, you feel healthier,
more energetic.
Your arthritis is a lot better.
Yeah, which is the only thing that I've had as a long-term medical issue, and that is definitely a lot better, definitely. I would say. I would say that there are three things. One is once you start this process, that you stick with it, you believe in it and have faith in it. If you just treat it as possibly this may work, possibly this not may work, that can affect your commitment to it. So belief and faith in the protocol and the process and everything that goes with it. The other thing I'd say is the discipline, which is not always easy, and as I say, you make mistakes sometimes and you don't always keep the discipline, but if you go back a little bit, if you take one step back, you take two steps forward, and you maintain that discipline. For some people it may be 3, 4, 5, 6 months. For me it was over a year. So when you get to that stage, you don't give up, you continue and you maintain that process. And the third thing I'd say is, having you beside me, Sharon, is that you do really need people who support you in this, whether it's your loved ones, whether it's the members of your family, and beyond that, in my case it was my GP, who continually supported me through this process, although it was taking out of the normal medical route for the UK. I had that support. So although I said earlier it's down to yourself, it's down. You're in the driving seat, but if I want to use this analogy, you're in the driving seat, but there are other people in the car with you. There are other people on this journey with you, and they are there to help you and support you. And I am most grateful for all the help that they have given me in everything that has gone on over the last year to take me from the place I was to the place I am now.